Welcome back. If you just joined us, you're watching the Big Issue segment. Today's topic is on non-communicable diseases. And we're saying, what should you know about non-communicable diseases? Of course, you've heard a lot about them or you've had something, but what don't you know about non-communicable diseases? And that's what you're looking at today. And with us is Mary Nyamongo, who is the Executive Director of the African Institute for Health and Development. Of course, we also have here Greg Hallen, who is a Program Leader at the International Development Research Center. Well, before we took a break, we chose to focus more on healthy living. Yes. And like you talked about some of the foods we're taking now, fast foods, and children do not understand why they need to move away from that. Parents need to find a way to instill that culture in the children. But like you mentioned before we took a break, there are four main causes of non-communicable diseases. You talked about tobacco and you mentioned healthy living. What other causes are there?
Well, we're talking about tobacco and healthy diets or unhealthy diets. The other key risk factors are excuse me, excess alcohol intake and also lack of physical activity. Alcohol first. Like tobacco, there's been increases in alcohol consumption. This also causes these non-communicable diseases. And I think once again we have to look for some of the low-cost solutions to regulating alcohol, so that it is more expensive and less accessible to the population. These are solutions that have been adopted in some of the more developed countries. And as we move ahead and find the proliferation of these diseases across the world, I think we need to find these solutions to reduce alcohol consumption. Similarly with physical activity, Mary mentioned earlier the changes to people's daily activity levels as a result of urbanisation. More and more people living in cities. They have less access to open parkland. It's more difficult for them to walk to work, walk from place to place, kids to walk to school. They may be less secure places to be outdoors and being active. These are solutions, this implies solutions to enable people to be more active. Not necessarily going to the gym and paying money to play sports and that sort of thing, but actually have activity built into their daily lifestyle, like most people have done for centuries. We need to build that back into people's lifestyles so that it happens naturally. Okay.
Well, Mary, let's look at what parents can engage their children into. Talk about exercise, what he's mentioned. What can we do? I know he's talking from a perspective of where he comes from, but the Kenyan perspective is a bit different, especially the culture that we have here. So how can we change the culture when it comes to exercise?
There are changes happening, but if you look at what is happening in our primary schools, when I was in primary school many years ago, we used to have PE, we used to have breaks in between, but increasingly in the last 10 years, there has been concern that the time for physical activity has been reduced. We also have sedentary activities at home where boys would be playing with their computers, playing games on TV, Xbox and PlayStation, where we really have reduced the amount of time children spend outside, and also the security issues in terms of allowing your children to walk, to cycle around. Some of us who can afford are really worried about allowing children to play just because, or to walk about because of the security issues. So there are multiple factors that are leading to having children more sedentary. TV is a big major culprit to this. How many of our children, they come from school, drop a bag, sit in front of the TV unless they're doing homework? And for some of the children, when they come home, they have so much homework, they will come, sit at the table, start doing their homework, they leave the table to go to bed. So in terms of allowing children time to play and providing the incentive for children to play, I think increasingly we are seeing children who tend to to spend more time either in activities that do not encourage them to be physically engaged, or because of the circumstances at home, they really don't have the space and time to play. Just to go back to the alcohol issue, I think Kenya has made a big stride in terms of the alcohol bill that was enacted, popularly known as Mututho bill, but it has been enacted from a social perspective about the social ills that come about due to consumption of alcohol. But what we are bringing in are the health impacts of alcohol consumption. How many of us after work would go to a bar, take a few beers, on top of that, or pass through a nyama choma joint, sprinkle salt on your nyama choma as you enjoy your beer? I think, how much energy are you taking, even in that space? So essentially, we begin to look at it not only from alcohol consumption, not only from that perspective in terms of how much it costs you to engage in that lifestyle, but also how much it is affecting you as a person, and how much it is affecting even your liver. That's another chronic disease. But also how much energy is giving you, how much energy dense it is, and how much weight you will tend to put as you engage in that kind of lifestyle. But also remember, you are taking a beer, you're taking nyama choma, you're sprinkling salt. So in terms of that one sitting, how much energy have you consumed, and how are you expending that energy at the end of that episode? It's something that we need to worry about. I think as we become more informed, we are seeing more women also taking up exercises. If you go to the gyms, you'll find a lot of women doing aerobics. But what Greg said, that's not what we talk about exercise. It's integrating physical activity in your daily life. It's walking to work, it's walking to the market. In the rural areas also, it's just not an urban thing. We are seeing even Mama Mboga having a boda boda. She's taking her goods to the market. She says, boda boda, kuja unichukue saa sita. You see, so even that activity of walking to the market is actually being overtaken by events, with this access to transport that can pick you right from your doorstep and bring you back in the evening. So we are seeing changes. And it's not just an urban issue, and I think we need to emphasize that. Access to fizzy drinks, access to Coca-Cola, access to Quencher is really up to the lowest level. You can get a soft drink anywhere in this country. So what we would like to do is to basically educate people. How much sugar, how much energy are you taking? How much of that are you expending? Because people say we lived like this from long ago, but we were more physically active. But are we as physically active as we were 30 years ago? We are changing, our lifestyles are changing, and our risk factors are also increasing. That's the message we'd like to give each person listening to us today.
Indeed. Well, Greg, you mentioned earlier on that it becomes very expensive to manage some of these non-communicable diseases. Well, the best thing definitely is then to prevent these non-communicable diseases. So what can we learn from the developed countries?
Well, I think first point is that the solutions in developed countries are not necessarily directly transferable to less developed countries. And that's why we work with researchers in countries like Kenya, and we actually fund research to try and find those low-cost solutions to these problems. The importance of research is in helping to identify the problem, measuring the burden of disease, also in research that helps to identify those solutions, and then also evaluating and trialing new solutions so that we know what works. We can find out what works, how different solutions can be improved.
Okay,
and so that when you do,
I'll just cut you short. Sorry, I'll cut you short. Then we can hear what your caller has to say. Then we'll go back to that. Sorry. Hello. Hello. Okay, we seem to have lost that caller. But you were saying. Oh,
just I guess I was the importance of evaluation of these solutions. Helps to tell us what works well And then when we do it well, it helps us to say, well, if we had not prevented that, look how worse it could have been. We've got experience in some countries where we have been successful in reducing consumption of tobacco and unhealthy foods. If we can say, well, if that hadn't changed, we know how much more disease would have occurred, and we know what cost that would have been to the health services and to the individual, and we also know how many more deaths there would have been. So this is where research can help to inform decisions about how to improve people's lifestyles and employ good population-based solutions to these non-communicable diseases.
Okay. Well, Greg has mentioned that some of the solutions he may have may not directly apply to Kenya. Mary, what would you say are some of the solutions we may have as a country that can help us prevent persons from getting the non-communicable diseases?
I would go back to what Greg just said, that some of the solutions may not be directly applicable to Kenya, which is true, but some of the solutions are. For instance, we know consumption of high sodium products is a risk factor. So I think in terms of beginning to ask ourselves how much, what are our main sources of salt, what are our main sources of fat, and how can we do, what can we do to reduce access to this? So therefore,
I'll cut you short. Sorry, let's hear what Aquila has to say. Hello? Hello?
Hello?
Hi, how are you? What is your name and where are you calling us from?
My name is Simon and I'm calling you from
Yes?
I just wanted to ask Mr. Greg that is there any website that we can read about the prevention and cure of the non-communicable diseases and what the youths can do to prevent the use of tobacco, to prevent the addiction of the tobacco, please. Thank you very much. Simon from Kisumu.
Okay, thank you very much. Well, he's first talked about prevention and cure of some of the non-communicable diseases we have. And Greg, I think he posed that question to you. So let's hear what you have to say about that.
I'm sorry, was he specifically asking about tobacco and some of the solutions?
Yeah.
Well, some of the things that we've found really do work, and once again I can talk about interventions on price. One of the most effective ways of reducing tobacco consumption is to increase its price. And a number of countries around the world have done that through taxation, higher taxes on tobacco products. And even better still, they've channeled some of the revenue from those taxes into health promotion. That is one of the most effective solutions. It reduces the affordability of tobacco products, which reduces the uptake of smoking by young people. It causes a reduction in consumption among those who already smoke, and causes a lot of people to quit also. Now that's one key solution, but we've also got to regulate the product in other ways. Regulate the marketing of tobacco. I understand Kenya's taken strides to doing that as well, but there's still a lot of product promotion, particularly at the point of sale, that I think we could take further steps to prevent. There is also the package of tobacco product that holds tobacco products that can be further regulated. If the package constantly reminds the smoker of the harms that he or she is doing to him or herself, graphic health warnings, clear messaging about the damage that's being done, and they're seeing that every time they pick the pack up, that's important also. I understand Kenya's also employed policies to create smoke-free areas, and I think that's a very important thing. I think we need to continue to make sure that smokers and non-smokers are able to work and live in smoke-free environments, and that's particularly important for children as well. So there's some key solutions. Of course, we also need to help smokers quit, particularly those who are ready and willing to quit. That's a little more of a costly exercise, but I think it can be less expensive if every health worker every doctor, every nurse who encounters a patient who smokes is able to talk to that patient about their smoking and give them some basic advice to help them to quit. So these are all things that need to be done.
Okay. Well, Mary, you were talking about prevention. And like we've established, it's more expensive to start managing any non-communicable disease. And so the best thing is to think of ways in which we can prevent some of these non-communicable diseases. I'm told we have a caller, so we'll just hear what the caller has to say and then we'll move on. Okay. Hello?
Hello.
Hi, how are you? What is your name and where are you calling us from?
I'm Margaret.
Yes?
Yes.
Yes. Yes. Okay. Yes, and she was told to take a lot of milk, that would help her. You see, this is some of the things patients are told. You're never given very clear direction and reason as to why you're taking whatever you're supposed to be taking. So it's good for the viewers as well to understand some of these non-communicable diseases. But to go back to what Margaret was saying, Mary, she was saying that she went to the hospital. She was told she has a problem with her sugar level, and she was told that taking milk would help solve that problem. What do you have to say about that?
We are very aware about the capacity of our health providers to, especially at the lowest level of health provision. The lowest level, we're talking about the dispensary and health centers. And we are increasingly considering measures of retraining some of our health staff so that they can provide the right advice to the patients they come into contact with. And what I can tell Margaret is she would need to go and consult a higher level medical doctor to give her the proper dietary recommendations to manage her condition. And sometimes there's a lot of misinformation. Sometimes we are told, I went to a doctor, and maybe you didn't go to a doctor. And so what I would advise Margaret is please visit a health facility so that you get comprehensive medical advice. You get comprehensive nutritional advice. Because for somebody to tell you to drink a lot of milk, what is a lot? And that's a question that I would want to ask. And I'm not so sure under what context that kind of message was given. So it is important to get proper advice and visit a medical practitioner who can provide that advice. We are also, in support with IDRC, beginning to ask ourselves, how can we address the capacity issues? And in consultation with other medical providers in this country, the question of how do we provide that support at the lowest level so that if a medical practitioner comes into contact with a patient, they can make the proper referral, they can refer to a nutritionist who can provide proper advice. They can also provide access to medical care that is comprehensive, that can meet the needs of that patient. So my advice to Margaret is please seek advice from somebody who can provide a more comprehensive approach to it. Greg, you may want to add to that.
Oh, no, I think that's a good response, certainly. But I mean, I would be suspicious of any advice that recommends one single food or a food group for that matter. One of the most important dietary recommendations is to consume a wide variety of nutritious foods, and that applies to everyone, including people with diabetes or cardiovascular disease.
Okay. Well, we were talking about prevention. Let's go back to that.
We're still talking about prevention, and in terms of calling these lifestyle diseases, I've been in very many functions where when you begin to talk about non-communicable diseases, somebody says it's the disease for the rich. And increasingly we are saying it's not a disease for the rich. Sometimes people say it's a disease for the West. However, the statistics currently show that although the burden is higher in the West, a lot of the mortality, a lot of the deaths really occur in low and middle income country. We were just talking with Greg before we came on air that the recently concluded United Nations high-level meeting on non-communicable diseases in New York in September this year was really focusing on how to prevent the rising tide of NCDs in low and middle income countries. So it is an emerging problem here, and the window we have, as opposed to the other countries in the West, is prevention. That we can do something to prevent these diseases from becoming a major epidemic in our context. And prevention means looking at what are the risk factors. When we started this show, we talked about the 4 key risk factors. This is tobacco, unhealthy diets, lack of physical activity, and harmful use of alcohol. These are the 4 main ones. In Kenya and in other African countries, we've also added infectious diseases, that if somebody has HIV, or if you're living with HIV, you then are at higher risk of getting also some of these conditions, including diabetes, cancers. You are at higher risk of those infections. So we've also looked at what's the role of infectious diseases in increasing your risk to non-communicable diseases. But what we are saying is that it's no longer a disease of the West. These conditions are with us. It's no longer a condition for urban people, the rich people. It is also affecting the poor. What can we do? How are we addressing tobacco? Tobacco use is not a problem of only the wealthy people. It's also a problem of everybody in this country, the poor, the rich. What the young man asked initially was, what can the youth do? What can the youth, the youth can do is to begin to create awareness about the risk factors. The youth have a big role to play. In fact, in some of our work, the work we're doing around research and on primary prevention, we're really focusing on the children. If we can begin to change the attitude, the behavior of young children, we then have a population that is growing up with higher levels of awareness, that they know the risks. Some of us, when we were younger, maybe nobody really talked to us about tobacco use. It was fashionable to smoke. But can we tell young people that it's not fashionable? It is a risk. So if we begin to educate young children, we begin to tell children that crisps are okay, but if you don't eat them every day. I was doing a sensitization in school, and they said, are you telling me KFC is bad? I should never eat KFC. And I'm thinking, I'm not saying you should never eat KFC. Once in a while, KFC is okay. But if it becomes a KFC day every day, then you are increasing your risk of developing these diseases as you grow older. What also Greg talked about initially is, for people who are children who are undernourished, as children, you are really stunted, you really are undernourished. We are seeing a changing in trend. When you become an adolescent and you have access to food, then your propensity to become obese is higher. So we are saying, even then, addressing nutrition of children, both the underweight and the overweight, it's a critical challenge for this country, and we need to address both. That the risks are higher even for that child who was undernourished. When they get into teenagehood, you see the levels of overweight and obesity increasing. But essentially, when you talk about overweight, and I think this is one thing that we need to go back to, we talk about body mass index. And sometimes people say that's a muzungu measure. Body mass index is just mean you are heavier than you're supposed to be, and a lot of us are. We also look at the waist circumference. If you measure your waist, there are measurements that put you within normal and put you within the overweight, obese levels. So if you see somebody with a distended waistline, it may look, it may be culturally unaangaliwa vizuri. For those who understand Kiswahili, you live a good life, but it's a risk factor. So when we talk about body mass index and we talk about the waist and hip circumferences, we're basically saying that your levels of risk are higher and you need to do something as an individual to begin to reduce it. So there are individual actions we are talking about, but again, when you talk about prevention, we're really looking at what the population can do to change the future of this epidemic that we know is certain. And as we become highly urbanized, we really are aware that we as a country, we are still grappling with communicable diseases. We should not be exposing our people to the risk of non-communicable diseases, and yet the risks are here.
Okay. Well, Greg, what intervention opportunities do we have currently?
In Kenya and the rest of Africa.
Yeah.
I was referring earlier to the low-cost solutions that are available to governments, and I guess one important thing to mention here is that the health minister cannot do this alone. The health professionals cannot do this alone. It really does require a whole-of-government approach. Ministries of Finance, Agriculture, Trade, Commerce, they all need to take a role in preventing non-communicable diseases, because this is not just something that health professionals can handle on their own. I was speaking specifically about tobacco control or the reduction of tobacco use earlier, and some of the interventions that are required there. They obviously require the support of the whole of government. I was specifically talking about tobacco taxation, which requires understanding from the Ministries of Finance, and they can take a lot of benefit from the revenue that may be gained by increasing tobacco taxes. So that's tobacco control. Similar efforts can be made in the regulation of alcohol and food, and what we're trying to do here is not reduce people's choices, but improve their choices by making the healthier products more available, more affordable, more accessible, not to completely remove the other choices, but to improve the profile of the food supply, the alcohol, and yes, there's no safe level of tobacco use at all. So we also mentioned earlier physical activity. With increased urbanisation, things can be done to make neighbourhoods more easier to be outside and to be moving around from place to place without the use of cars and buses all the time. So and the use of bicycles. So getting kids out, but also adults out being more active, requires changes in the way we plan the urban environment and plan neighbourhoods to make it easier and safer for people to be active.
Okay. Well, there's a forum tomorrow. Mary, tell us a bit about the forum.
The African Institute for Health and Development, together with the Non-Communicable Diseases Alliance for Kenya, which brings together many associations, including the Kenya Cardiac Society, Diabetes Management Information associations, and other professionals working on NCD-related activities, are holding an open forum. And this forum will be looking at the research needs and the capacity building needs. We've talked about access to health professionals. We've talked about the need for screening. We're really emphasizing the need to understand what are the risk factors and what can be done locally, what low-cost solutions can be put in place to be to help in prevention of exposure to the risk factors that are responsible for a lot of the non-communicable diseases. The forum will be held at the Crown Plaza Hotel in Upper Hill. It will be The official opening will be done by the PAs responsible for National Council for Science and Technology. It brings together people from Kenya, experts from Kenya, but also experts from the region. We have representatives from Ghana, South Africa, Nigeria, and other countries that are all grappling with understanding the local context and the regional context of non-communicable diseases in the country, in our region and in our countries. We also would be disseminating information on the United Nations High-Level Summit. We'll also be talking about what we are doing in Kenya, what are our population-level interventions, and what individuals and institutions and communities need to do to prevent non-communicable diseases. Prevention definitely is the message we are sending out, and the fact that knowledge and culture, I will not finish, I'm an anthropologist. It's important to look at the role of culture, what we consider healthy, who we consider a health person, who we consider a wealthy person, and all things about how we look at people and how we stereotype people are important. That if you are fat, you are healthier, you are wealthier. I think that's something that we need to be changing. That if people see you walking, it's not a good sign. It's good to walk. It's physical activity. So even just talking about our own attitude as individuals and as society and as Kenyans and as Africans is something that we really, as an institution and as partners in this, need to worry about. Greg mentioned something important, that Ministry of Health will not do it. If we want to change the way people live in Nairobi, if we want to increase walking to work, we really have to work with the City Council. We have to work with the Ministry of Transport. We have to work with the people in roads. We have to also ensure there's security for the people walking. So it is a whole of a multi-sectoral approach, bringing different people around the table and saying, how can we make it safe and accessible and easy for people to walk? How can we market our products? How can we ensure that Ministry of Trade is around the table? So it's not a Ministry of Health initiative alone. It's not a burden for one sector. It's a burden for all the sectors of development. And we'd really want to encourage people to begin to think about the health of Kenyans in the next 30 years. What do we want to see as a healthy Kenya as we move forward?
Well, thank you very much for coming.
Thank you.
Today's topic was on non-communicable diseases, and definitely what Mary and Greg are saying there is we need to take care of ourselves better. Especially when it comes to what we consume. Let's watch out on how much we consume and what kind of foods we're consuming, and of course much more. Talk about tobacco. We need to consider how much we consume tobacco. There's so much more. I'm sure most of you and each of you who was watching today's interview has learned. Let's also take that information and use it in our daily lives. Thank you for watching the Big Issue segment. My name is Leangare. Keep it K24.